My name's Leonard Miller, and I'm honored to be this year's recipient at the City of Hope's Spirit of Life Gala. I want to thank each and every one of you for the time, the money, the fundraising, and the hours that are going to go into this year's event. I feel very appreciative, humbled, and honored to be this year's recipient. About 5 or 6 weeks ago, I was approached by Pat Murphy, and he asked if I would consider being this year's recipient. You know, it was something I never even considered would be a possibility. I think of all of those who were honored and came before me. And you go through and you say, wow, you know, there's a great responsibility in being this year's recipient. And my first concern and thought was, wow, City of Hope is such a great cause, and it's really personal with me specifically, and I'll talk a little bit about that. But could I go out and raise the amount of money that the cause? Can I go out and raise the money and the level of support that others have before me, and really kind of match up to that level? But as I thought about it and considered about it, most of you probably wouldn't know this about me. A little less than 2 years ago, I was diagnosed with prostate cancer. I'm one of the fortunate ones. Fortunate that I knew somebody that I worked with closely here who referred me to the City of Hope. Within 24 hours, I received a phone call. Within a week, I was being seen with an appointment. That just doesn't happen with healthcare here in the United States, and I felt very, very fortunate. The thing that I think stands out most when I think of City of Hope in the last 18 months is I'll never forget driving up that first day for my first appointment, parking my car and being greeted with a parking attendant. I know that sounds like a minor thing, but it struck me the care, the consideration, the love that was shown from that first interaction. Then I walked towards this beautiful facility, seeing this wonderful fountain that gives you hope, and somebody immediately greeted me outside, asked how I was doing, and walked me into reception and introduced me there. I could go on and on, but over every interaction over the next 18 months, what I can tell you is the care, the love, the support that I found through the City of Hope was like something I had never experienced in my life. From the doctors to the administrative staff to those that take your blood. When people talk about customer experience, that seems odd and a personal touch to even mention something like this. It was truly world-class customer service. City of Hope is set apart from others with their research, their cause. But what I experienced again was the love and the support of the staff. Other memories are really twofold when I think about it, and I try to describe to others. But you really need to see it. It's very hard and difficult to explain, but I'll do the best that I can. So often over the 18 months, you go into a reception area and you have blood work or tests that are going to be done, and you sit in a waiting area. And there might be 80 to 100 people. And you're struck by the diversity of those around you. People of all colors, races, circumstances. You see grandparents with their children. You see spouses, children of all ages. Maybe they're the ones that are the patient and the impact. And you look around. And what you do is you're struck by looking through their eyes and seeing the fear, a balance of fear, hope, support, and care. What places like the City of Hope do is they give families hope. You know, I'm an optimist by nature, and I figured I would be okay. And relative to others, that my problem or my sickness, I felt like I was going to be okay. And others had such more serious things to do. But I can also think of when I found out after I had the surgery that things look great for my future. I can remember my wife, Christy, crying. I was okay, but she needed the love and support that she received through the City of Hope. Excuse me. The next thing is, and probably the one picture I have in my mind is I can picture so many times you walk down these long corridors. Looking at me, I'm 56, and you would never guess it. But I have 4 daughters, starting at the age of 23, all the way down to 18 months. So while I was going through this, my wife, Christy, was pregnant and we delivered Leighton. And quite often, Leighton was with me with some of these appointments. And I remember walking down these long corridors and being humbled by those that I was surrounded by. People that had cancers of all types with all levels of diagnosis. You'd see people with walkers, chemo bags, and all of the fears and everything that they had there going on in life. And they would stop. They would fuss over Leighton and leave all of their challenges and problems behind and focus on us, or me, or my little one. And you sat and you thought, my God, you are facing so many challenges here. It's haunting, it's humbling, and I am just one of the very, very fortunate ones. I can tell you this, you have many people you can support and you have limited resources or time. I can't think of a better cause than the City of Hope. City of Hope not only provides world-class research, a facility, but I'll go back to where I started. The love, the care, the genuine support from the staff at City of Hope. Again, in my lifetime, I'm 56 years old, and I've never seen anything like it. I really hope that you'll consider supporting this year's cause. I can't think of a better cause, and I'm very humbled that you would have thought of me, and I feel very, very honored. Thank you. When I think about this year's event, what resonates with me is that hope is truly the cure. I want to thank you again. When I think of this year's event, what really resonates to me When I think of this year's event, what really resonates with me is that hope is truly the cure. I want to thank you for your consideration and thank you for all that you've done for both me and the City of Hope.